Welcome to Suhail's Paramedical Nursing Academy. This is the third part of the body temperature. I explained before this. I explained two lectures. In the two lectures, I explained about the vital signs, introduction of vital signs, and what are the different vital signs in our body. Then I explained what are the different vital signs that we are assessing in our body, and then I explained about the body temperature. First vital sign, that is body temperature. In first vital sign, that is body temperature, I explained about what body temperature. In body temperature, in body temperature, I explained thermogenesis, mechanism behind the thermogenesis. Then I explained thermolysis. Thermolysis, what is the mechanism behind the thermolysis. Then I explained about the factors affecting body temperature. This all I explained very deeply. I think no one will be having any doubt in this part. Okay. See here. Today what I am going to explain. Today's topic is assessment of body temperature. How we will assess the body temperature of a person, of a client, of a patient. So first, how we assess the body temperature of the person. Remember one point here. Before I am going to present the assessment of body temperature, I will tell here one additional point. This is also important here. What is that? One is core temperature. What is core temperature of body? Core temperature of body. Okay. Another is surface body temperature. Core body temperature, surface body temperature. Remember, these are the two important temperatures. Actually, what are these? Core body temperature is a temperature that we are calculating from the deep organs of our body. That we are calculating from the deep tissues of our body, deep organs of our body. In core body temperature, deep organs. What are the deep organs? Suppose urinary bladder. Then after urinary bladder, there is suppose oesophagus. There is pulmonary artery. Pulmonary artery. So these are the three main parts: pulmonary, oesophagus, urinary bladder. These are the organs which are deep, and we are assessing the temperature from this. This is core body temperature. The temperature we are getting from these organs is core body temperature. And surface is, we know, surface body temperature that we are getting from the surface organs. Suppose we are by means of oral way, by means of rectal route, oral route, axilla route, okay, or any other route. Suppose temporal artery route, okay, or we can say this is the surface temperature. Remember, sometimes they write here one more for core body temperature. They write one more here, that is tympanic body temperature. Here we are using externally we are using the digital thermometer to calculate the body temperature in case of tympanic body temperature. But the thing is, why they have put this in the core temperature? Some books have written this tympanic body temperature in the core body temperature. The reason is actually what? When we are putting the digital thermometer inside the ear artery canal. Inside the ear artery canal there is eardrum. At the eardrum we are keeping this thermometer, this tympanic thermometer. Tympanic thermometer, when we keep there, remember the inner ear, middle ear, inner ear has direct the hypothalamus, the brainstem. The hypothalamus, the brainstem is close to the inner ear, is close to the ear system, is close to the inner ear. That is why it takes only 1 to 2 seconds to calculate the body temperature from the tympanic side. So this is also considered as core temperature, because this is actually it has direct connection with the hypothalamus. Okay. So it gives the correct data also. So that is why we have considered this in the core temperature. And this surface body temperature, I told what are these. Now I am going to explain about the assessment of core body temperature. Assessment of body temperature. In assessment of body temperature, first thing is Thermometer is used for assessing the body temperature. Thermometer is used for assessing the body temperature. This is the first point. Then we say, what is thermometer? Thermometer is a device that is used for assessment of body temperature. And now we will see what is this device. First we will see types of thermometers. What are the types of thermometers? Okay. What are the types of thermometers? One thermometer is clinical thermometer. Clinical thermometer, and another thermometer is what? Electrical thermometer. This is the first one. This is the second, electrical thermometer. And third one is, remember, third one, clinical thermometer, electrical thermometer. Another is disposable, heat sensitive thermometers. Heat sensitive thermometers. Okay. Fourth is, suppose tempo dots are used, tempo dots, and they have written one more there, that is temporal artery thermometer. So some books have not written this point, temporal artery thermometer, but some books have written this temporal artery thermometer. Remember one thing, actually, why I told that some books are writing, some not, because before I am coming here, I am consulting 2 to 3 books. 2 to 3 books I am consulting. So some books are writing different, some books are writing same like I am here writing. So here I have taken temporal artery thermometer. These are the different thermometer. Okay, here I think I have done one mistake. That is, here this is heat sensitive thermometer. Okay, heat sensitive thermometer. Okay, it is disposable also. Heat sensitive. No, this is heat sensitive thermometer. That is different. This is heat sensitive thermometer is another thermometer. Another is disposable thermometer. Okay. One more is here. That is disposable is different actually. Heat sensitive thermometers is one, and heat sensitive thermometer, fifth one is heat sensitive thermometer. Heat sensitive thermometer. Today actually I don't have today that much of energy to present the class, but I will complete this. Actually, so heat sensitive thermometer is fifth one. Clinical thermometer, electrical thermometer, heat sensitive thermometer, temporal thermometer. See here, actually in clinical thermometer, remember this is mostly that we are using. Clinical thermometer that we are using the clinical setting, in the hospital setting. And this is the electrical thermometer that we are also using this electrical system. Suppose we are using in the ICU. In ICU we are using this electrical thermometer. It depends, which is based on the infrared radiations. Okay, this also we are using. Heat sensitive thermometer is what? Heat sensitive thermometer is what? We are using this also. Remember one thing, in case of heat sensitive thermometer, or you can say some books are writing this as heat sensitive tap. Okay, for correction, because you may open the book, you will say what he is saying. Heat sensitive tap. In case of heat sensitive taps, we are using tap. There are tap like thermometers that we are putting either on the forehead, or we are putting it on the abdomen. Then what happens? There are colors here. The colors will change. Colors will change into red. Where the red color will stop, it means this is the body temperature of that person. So heat sensitive taps, they are called heat sensitive taps. Other is I told disposable thermometers we are using also. Another is tempo. Okay, tempo dot thermometers we are using. These are mostly we are using this type, electrical and clinical. These are also present, and temporal artery thermometers that we are using. This is also the digital thermometer. Okay, temporal artery thermometer is also the digital thermometer. It is also the digital thermometer, which we are using here on the temporal artery, and it will give produce infrared radiations to get the body temperature. Oh, this is temporal artery thermometer. These are the types of thermometers. What are the different types of thermometers? Okay, this was the first part. the types of thermometers. Now after the types of thermometers, what I am going to explain, the first is clinical thermometer. First point I told here, clinical thermometer is the mostly used in our hospital setting, in the clinical setting. Second point I told about that in clinical thermometer, what is the highest reading? In clinical thermometer, what is the highest reading and what is the lowest reading? Okay, the highest reading is what? The highest reading. The highest reading, the lowest reading. The highest reading and lowest reading in case of clinical thermometers, the lowest reading is the lowest. What is the reading in thermometer? The lowest reading in the thermometer, what is that? What is the highest thermometer? What is the highest reading in the thermometer? Highest reading in thermometer will be how much? In case of degree Fahrenheit, it will be 110 degree Fahrenheit. Okay, or if we tell in case of degrees Celsius, it is 43.3 degrees Celsius. You can convert this also by, I will tell after some time formula also how to convert this. Lowest reading is what? Lowest reading is how much? 35 degrees Celsius, or we can say the lowest reading is 95 degree Fahrenheit. 35 degrees Celsius, 95 degree Fahrenheit. This is the lowest reading, this is the highest reading. For what? For clinical thermometer that we are using the clinical setting. Now I am going to explain the parts. This is the reading I told. Now I am going to explain what are the parts of clinical thermometer. Remember clinical thermometer is also of two types. That will depend upon the parts and site that we are using. Where we are using this thermometer and what are its parts, that will decide what are the two types of clinical thermometer. One clinical thermometer is that we are using on oral clinical thermometer. Okay, oral thermometer. Another is rectal thermometer. See here, actually what actually is oral thermometers? What is the difference is important. This is the thermometer that we are using for oral route. Rectal is the thermometer that we are using for the rectal route. What is the difference there? That I will show in the structure. Suppose I will put here, this is the thermometer. This is the thermometer. Okay. Okay, this is thermometer. This is the one more thermometer. I have to tell actually the difference. Okay. Here I have to tell the difference. These are the two thermometers. Remember this in thermometer, what are the parts of first? Here I will explain also the parts of thermometer. Rectal and oral are the two thermometers, and also what are the parts of thermometer. See here, parts of thermometer, this part is called as, one is this part, another is this part. This part is where the mercury is present. The mercury containing part is called as bulb. This is called as bulb. And this part is called as situm. These are the two parts. And this is the mercury line here. This is the mercury line, and this is the readings. This is the readings on the thermometer. These are the readings on thermometer. Okay. Now what I am going to say, these are the parts. Bulb is there, situm is there, mercury is there on the bulb. Actually, is present on the bulb, and these are the two thermometers. Why I presented here? I am telling actually the difference between the rectal and oral thermometer. And one more point, I will ask one question: why scientists? Why the person who had made this thermometer has used mercury, not any other substance like water? Remember this, there is reason for that also. Why mercury has been used for thermometer? The first thing is that the mercury is an liquid metal. It is the metal, but it is the metal which is present in the liquid state. This is the introduction. And the mercury, remember this mercury is having the first, what are the first reason is, it is an heat sensitive. Mercury is an heat sensitive liquid. So suppose if there is slightly change in the heat temperature, it will show the reading. That is the first thing. Second is, it is easily detectable. Why mercury is used? I am giving the reason. First I told that why mercury is used. Here I will tell. Before I am going to say here, I will tell here. Okay, why mercury is used? there is not so much space. Why mercury is used? First I told that mercury is used because it is what it is. First it is a liquid matter. I told that mercury is a liquid matter. It is heat sensitive. It is heat sensitive. Second is, one is it is heat sensitive. One is it heat. One is it is heat sensitive. Another is what? Another is it is an easily detectable. There are other reasons also. I will tell every reason, but these are the main reasons if question will be asked. Heat sensitive. I told if there is slightly change in the heat, mercury will rise. If there is or down, easily detectable, we can easily. Why it is easily? Because it is silver colored and shiny. It is silver and shiny color. That's why it is easily detectable. And another thing is, it is having high melting and boiling point. Its melting point is approximately. One is boiling point, another is melting point. Boiling point is approximately 350 degrees Celsius. 356. Some books write 356 degrees Celsius. Okay, but it is melting point is also what? Minus 38 degree Celsius. So this also makes the thermometer for use. Otherwise, what will happen if there is slightly change in the if there is high change in temperature, the mercury will boil. It will undergo for vaporization. That is not happening here. That I told is another point why mercury is used. One more point is also there is having high surface tension. It is having high surface tension. That is why it is present in like droplet like forms on the thermometer. Leave this thing. I told. I will tell also this. I told here why thermometer is used in the thermometer. Suppose what happen if thermometer will break. This is another point. You write on the book on note on your own words. If thermometer will break in your clinical setting, during hospital setting, what you will do? This question is also asked sometimes. What should we do? What should we do here? I will write this after that. What should we do if the thermometer will break? Remember one point. First thing what we will do, that is we will take a paper sheet. Remember, don't use any soap or anything to clean the area. That is not the good procedure. That is not the good thing. First, if thermometer dropped, this is the thermometer here. This is the thermometer. If this thermometer dropped on the floor, what will it break? It break. Mercury will come out from the thermometer, and there will be presence of mercury. When there is presence of mercury, we have to take the sheet. Take the sheet. First, if we don't take the sheet, before taking the sheet, what we have to do, that when there is presence of drops of mercury, we will use there is one how to take this first. Don't use hand, don't use anything. First we have to take this eardropper. Eardropper is there, one eardropper which is providing the drops on the ear or eye dropper. There is one dropper, that is eardropper for ear. Eardropper we will use to take these drops. And now after taking in the eardrop, then we will place in a plastic zip containing container. Actually, what is this? If it is present here, suppose this is the thermometer that we have. Thermometer that is on the surface. First we will use it is like this. This is actually what? Eardropper. We are here pumping here, and it will take these drops. It will take this. Then we will put in the bag. That is zipped bag. That bag is zipped bag. It is present in the hospital. In zipped bag we will keep. Then after put in the zipped bag, then put the second cover. That is second bag. Then put the second bag. After second bag, then put the third bag is also put. Third bag is for precautionary reason. Third bag is also put. Then after the third bag, what we are doing? There is a big wide plastic mouth containing bucket. It is sealed in there. It is sealed in what? Here I will take. It is sealed in. Here I will put. See here, zipped container. Here I will write first. It was the mercury here. Now we have put in what? Eardropper we have used. Eardropper. Then after taking into the airdropper, now we will use the zipper bag. First zipper bag. This is the first bag that we are using. Then is used second bag. Then second bag is used. Second bag is another bag is used, and the second plastic bag. And then third bag is used. Then third bag is also used. After using the third bag, we are using what we are using. A sealed. We are now after using third bag, we will seal this bag in container which is wide container, a wide container. It is sealed in the wide container. Wide container. Actually, wide is called wide is wide mouth. It is the container has wide mouth, so it is called a wide mouth container. We will keep in this. Then we will dispose this according to biomedical waste management. So why we are using this much of procedure? Airdrops, then zipper bag, second bag. We can use, we can use the disinfectants. We can use soap. We can use soap, or we can use any other Savlon like that. Why we are using this procedure? Actually, mercury isn't toxic. Mercury isn't toxic. And one more thing I got here. One more point. It is toxic. Another, it causes a disease that is Minamata disease. Minamata disease is a neurological disease. Actually, it is a part of psychology. Minamata disease is a neurological disease that is caused due to the mercury. Because mercury is actually what? This is the metal. This is the liquid metal that increases in the food chain. If that is called as biomagnification. That is the different topic. Biomagnification means what? It will, if it is present in suppose if it is present in the fish, if fish it is 5 gram mercury. When it will enter into our body, it will concentrate more. It will be, if in fish it was 5 gram per kg, in our body it will be 10 gram per kg. It is concentrating in the food chain from downside to upper side. When in food chain we are going, it is concentrating. That is biomagnetism. So it will cause Minamata disease in case of humans. It cause Minamata disease in case of that is a neurological disease where there will be numbness, where there will be cerebral palsy. So there will be all the disorders in case of. That is the different topic here. Minamata disease it is causing. So it is toxic also. I told. One more thing is there. That is, I told here that thermometer has two types. One thermometer, this is oral thermometer types. One is oral. This is rectal. In case of oral thermometer, the bulb will be cylindrical. Oral thermometer में क्या होगा? What will be in the oral thermometer? What will be in the oral thermometer? In oral thermometer, the bulb is cylindrical, and it will be long also, long and cylindrical. Okay. And in case of rectal thermometer, remember the bulb is what? It is like a blunt shape. It is like a blunt shape, or we can write here, blunt is another word is stub. It is stubby like. Okay. Bulb is stubby like or blunt shaped here, like this here. Okay, and it is short also. And you see here, it is short also. These are the two thermometers. These are types of clinical thermometers. I told here that parts of thermometer. I told the types of thermometer of clinical thermometer, parts of clinical thermometer, types of clinical thermometer. Why we are using the mercury? Why mercury is used in the thermometer? That I told. If mercury will be, if mercury drop, if thermometer will broke, what we have to do in the hospital setting? That I also told. How we have to take this. Then I told about what mercury is toxic. So for toxic purpose, we should maintain that procedure that I already told here. Now another thing is that how we can clean the Savlon, how we can clean the thermometer. Actually, this is the part of procedure. But before I am going to procedure, I will tell this here in clinical thermometer. How we clean this clinical thermometer, rectal or oral. We are using a what? 3 solutions are used. If we use we can use disinfectant, we can use Savlon. These are the disinfectants. Savlon, another is Lysol, another is Dettol. Remember here, the entrance point is here, the viva point is here, the entrance point is here. What is the ratio that we are taking here. For in case of Savlon, 1:20 we are using. What is 1:20 ratio? Many students are saying that 1:20. They don't know what is 1:20. Some are saying 1:100 like that. Because how can we have to first understand what is 1:20 ratio? This is 1:40 ratio. This is 1:40 ratio. Savlon is 1:20 ratio. What is actually 1:1 ratio? 1 ml. Suppose if we take 1 ml of Savlon, we have to take 20 ml of water. Suppose if we take 5 ml of Savlon, how many ml of water we should take? 5 ml of Savlon, we should take 100 ml of water. Okay. If we take 5 ml of Lysol, how many ml of water we should take? 40 into 5, that is 200 ml of water. You can use not here ml, you can use drop here, number of drops also, because ratio we have to take same. Here, if you will take 1 here, it will be also 200. So this is the parts of Savlon that we are using. Cleaning of thermometer, how thermometer will be cleaned, or how the thermometer will be disinfected. We can clean it by means of water also, using some soap, but this is the disinfectant method. Here we are destroying the microorganisms on the thermometer. This is the one more point. Another point is remember one thing, when we are using the thermometer. One more point I remembered here, that thermometer should not be put in the hot water. If we put in hot water, it may break because it is a glass thermometer. That is why clinical thermometer is also called as, or